You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back to the Your Knee, Your Health podcast. I'm Adam Rosen. In today's episode, I want to talk to you about a question that comes up very commonly in the office, and that's always, what is the best implant? Patients always want to know how to get the best total knee and what is the best implant for them? They think they're young, they need to have a long-lasting implant, or they play golf, or they play tennis. They want the implant that they think is best for them. To make it short, the simple answer is there isn't one. Obviously, if there was a best total knee implant, everybody in the world would be using the same total knee and everybody would be getting the same implant. And maybe even if we knew what is the best implant for golf, maybe, what if you're right-handed or left-handed when you hit the club? But there isn't, and that's kind of the reality. So don't go searching for the best total knee. Now, it may be a simpler thing to say, well, what's the worst total knee? And that's where registries come in handy. America has actually been slow to the race of getting a registry in place. We've had a lot of institutions that had individual databases where they would collect information on implants. And just recently, in the history of implants, we're talking in the last couple of years, have we developed an American Joint Registry? And not every doctor and every hospital in America participates in this, but a lot do. There's over 1 million implants that are in this database now. But other countries have had databases for a long period of time. And what they have been able to do is actually find out early when implants start to fail. Because if I put an implant in and patients move or they have a problem and they see somebody else and that person fixes that implant, I never know that there's a problem because I never see the patient back. So if you're in another country and you have an implant placed at hospital A, but then you move or travel to hospital B, that information gets put into the database. So at least the country knows that, hey, there's an issue with this implant because people, they always want new. That's another thing that I see patients come in the office. I don't want an old implant. I want a new implant. Well, new is not always improved. It's not new and improved until it's been tried and true. Because you see this all the time, new implant comes out, and then unfortunately, 2 years, 5 years down the road, there's a high failure rate, higher than the failure rate of the implants that have been around for 15 or 20 years. Because we don't really know what the 20-year survivorship of the knee will be until we get to 20 years. So it's really important to not always rush into the latest and greatest thing that's on the market because it may not always be the best thing for you. And the next thing I always tell patients is, don't make the surgeon use a particular implant because you should ask your surgeon, what do they use and what do they feel works well for them? Because they're the expert. They're the ones that are doing this all the time. You'll have some surgeons that only use one implant because either that's what they were trained with or that's what they're comfortable with or that's what they feel they have good results with. Or sometimes that's the contract that the hospital has, and that's all that they can use. So if you then tell the patient, well, my friend, had this knee implant, and I want that one, we can all do it. To be honest with you, a lot of the implant companies, they're very, very similar. But there are slight and subtle nuances and differences with the instrumentation and the balancing. So if you have a surgeon that is very comfortable with company A, and then you force them into using company B, it may not work out as well as you had hoped because they're essentially learning on your knee. You have other surgeons that use lots of different implants. So they might be really comfortable with using any number of implants if you have some particular reason for that implant. So for me, I have an implant that I have been using almost 15 years now. I've put thousands and thousands of that knee in. In my hands, that knee works very well, and I have very good success with that implant. So that, for the most part, has always been my go-to. But I do use lots of other implants. Why? Well, one, I do a lot of revisions. So I always want to be comfortable with all of the different knee companies and systems, because if somebody comes to me with a problem and they need a revision of that knee, it shouldn't be the first time that I'm using that system. And when I trained, I used lots of implant companies. So I kept up my skills with each of those companies to make sure that I didn't lose all those little tips and tricks that I've learned. Because if I meet somebody and let's say they have a knee done on one side, but now they're coming to me for their second side, and they love the knee that they have on the right side, but I have to do the left one, and they really want me to use the same implant. They want the same implant that they've had good success. That's completely fine with me because I'm comfortable using those implants. Because, the mind's a funny thing, that if you love the knee on the right and the doctor is going to put a knee in on the left and they have a different implant company that they use, and it just doesn't feel right to you, or it doesn't feel the same, or maybe it's a little stiffer, or maybe it's a little looser, maybe a little bit more swollen, your mind and you are always going to, figure it's because it's not the same, and the data doesn't show that. When we look at the data, which looks at the range of motion and the pain scores and the longevity of all the major players that are on the market, there is not a study out there that is the gold standard study that says that this is the best implant and this is the worst implant. Every company has their data, which shows survivorship at 5 years and 10 years and 15 years and 20 years, and the society scores that we look for in range of motion. But statistically, there isn't one that is way better than the rest of them. And a lot of studies have been done when you even look at one surgeon, and you look at one surgeon with different implants, and all the outcomes are essentially the same. But again, our mind is funny. It tends to fixate on things. So I have this discussion with patients, if they have a knee on one side and they love it, I am more than comfortable in matching that and putting the same implant on the other side. And the same thing, I have patients that say, yeah, I had this knee done a couple of years ago, but it just doesn't work great. And, do you have another implant? Is there maybe another system works better for me? And I said, yeah, there's another system. We can use it. I can't guarantee that it's going to be any different, but, I can put a different knee in. And sometimes people just feel better that they had sort of company A on, one side that just for them wasn't a great outcome. It was good. And now they have company B on the other side. So that's kind of a really important thing. And, it comes down to, when patients ask, well, why do you use, this particular one more often than the others? And again, there are some scientific reasons on, certain things that I like about the implant that I use. But I always tell people, if you have a license and you can drive a car and you go on vacation, you can rent any car off the lot. You can get behind the wheel of the car. You can get to where you need to go. So most surgeons in the world could walk into an operating room and take any knee system and perform a total knee. The cut, the jigs, they're all pretty much similar, if not in a lot of ways identical and interchangeable. There are some subtle nuances between the angles of certain cuts and the way that the balancing feels, and kind of a minor few steps. But, for the most part, it's all the same. So you can kind of get through it. But if you know a system well, you just move a little bit more efficiently. So the anesthesia is a little bit shorter, and you may understand the balancing, the subtleties of the feel of the knee, and how to make minor changes just to get this thing to drive straight. And that's kind of like the car, where, your car, you just kind of know the brakes, and you know where the controls are, and you know the seat position, and you know the mirror position, and you're just a lot more comfortable getting from point A to point B in your car, where you could do it in any other car, but the seat's a little different. The controls are a little different. The brakes and the accelerator are a little touchy. And that's sort of like the art of the total knee, is that, you can kind of just do one very cleanly and efficiently if you're used to it and you've done hundreds and thousands of this particular implant, where if you have something different in front of you, it's still going to turn out okay, but, you may have a little bumpy starting and stopping throughout the case. Now, when it comes to, different implants, because people have questions, years ago, there was a big, direct to consumer marketing of this knee, that the only knee on the market that bends and rotates, what's called a rotating platform. And, if you think about it, your knee bends and straightens. It doesn't really rotate. It pivots, and all knee implants on the market can pivot. But, the rotating platform is one of those things that was sort of marketed to patients, and patients not really understanding what that is, wanted that, for a while. And then there was the gender knee that came out, as a male and female. And, all patients wanted that because I want the, the knee that's made for my gender. And, what's interesting is actually when you talk to designers, that it was kind of a weird decision to call it a male and female knee because, if you had a female and the major difference was the width. If you had a female who happened to have large or wide bones, and you put a male knee implant in her, patients are always curious. Well, did I get the female knee? No, you got the male knee because you got good, strong, healthy bones. It was a really awkward decision or discussion, rather, if you had a male and oh yeah, I get a male knee. Oh no, you got a female knee just because your bones, it was a little narrower, and it was just kind of an awkward discussion, telling a guy when they asked the question that, yeah, they got a woman's knee. So that really wasn't a great way of doing it. A lot of companies, have come out with what they just consider, their standard knee and what's called a narrow, or some companies have designed it based on studies of CAT scans to, basically anatomically control the width for the smaller sizes, which are a little bit more narrow because more commonly smaller sizes are in women, and the larger sizes, which are a little wider because the larger sizes are typically more in men. But as the years have progressed, they've definitely become a lot more anatomic, a lot more contoured, a lot less boxy. But there's other implants that are out there that talk about, customizable, or, really you can customize the thickness and this and that and different things. And the reality of it comes down to, and this is, the good and the bad, is that we really don't have a 100% complete understanding of why some people have total knees that hurt or bother them or don't feel great. And that's, I've talked about this before in other ones. A knee replacement is a great operation, but it's not perfect. It doesn't give you a normal knee. It gives you better than a bad arthritic knee. And the confusion for us is we look at numbers, right? We look at computers and we look at CAT scans and x-rays, and we have certain measuring devices with navigation and robot, and we can, align things nowadays within a millimeter, half a millimeter, a degree, a half a degree. And we have these numbers that we aim for. But what we don't really understand is why, when the numbers are perfect, some of those people still hurt. And you have knees that don't look always perfect on x-ray, but those knees and those people feel great. So why does a tight knee in this person, they love it, and a tight knee in the next person, it feels too tight and painful, and vice versa. You have a loose knee in this person that they hate, but the loose knee in the next person feels great. So that's what I've always believed, that there is an art to the balancing, that, if you have somebody who naturally is loose jointed, not that we leave a knee loose, but you want to try to match the person's soft tissue tension to their body type. And if you put that in too tight for that person, that's not normal. And if you have someone that's very tight jointed, and you leave that person loose, more typically that person's going to have pain or symptoms. But we don't have an implant that is made specifically for that person. We may one day, very, very possibly, be able to identify, a specific cut or angle or implant size or style, but at the current point in time, we don't have the best. And that's kind of what I led with, is that if you're looking for the best implant in the world for you and your activity and your age, it doesn't exist. So you want to find a surgeon that is a high volume surgeon, someone that you trust, someone that you can have a good rapport with, and a staff, again, like I've talked about this before in the episode on how to pick a surgeon. You want to make sure that you can have open lines of communication. So if there's questions and if there's problems, that you're able to get in contact with their staff, with their PA, with their nurse, with the doctor, so you can make sure that throughout the process before, during, and after surgery, if things arise, that you can have them addressed. But have an open discussion with them. And if the doctor that you choose has an implant system that they believe in and that they're comfortable, then that is the best implant for you, with that doctor taking care of you. And try not to, stipulate what you think is the best implant, because we don't know. And that's really the honest truth. So I hope this has answered the question, again, that I get asked lots and lots and lots of times as to, what implant are we going to use because they want the best. There isn't one. But you want to find a good surgeon, and you want to do your best with physical therapy, and that is what's going to give you the best total knee at the end of the day. So thanks for listening. I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. If you've enjoyed what you've heard, please refer a friend, leave a comment, send the link off to a friend that you think would benefit from this information. And then until next time, stay safe. You've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.